Good afternoon, everyone. Thank you for the invitation. I'm honored to be here. I'm very glad with this meeting. It's the first time at SAGES, and I really appreciate it. And thank you for the chairs, my colleagues, and all who stayed so far this afternoon. So the topic I'm supposed to do is expanding HPB cancer care in South America, and I have no disclosure related to this topic, just for you to have in perspective. The overall mortality all around the world, especially in the occidental countries, is the first cause of mortality is heart disease, but cancer is increasing, as you can see here. And also, as you can see, the HPB diseases have an important role regarding this mortality and increasing mortality of cancer. So, South America, for those who don't know very much, is a big place in the world. As you can see, we have around 430 million people, half of this area and populations in Brazil, actually. And as we know, surgery is still the main chance of cure for most of these cancers. Most of the time, we fall into a multidisciplinary setting, of course, but many other advances regarding the surgery of HPB cancer. So, as we can see here in this meeting, we have invasive robotics, the multidisciplinary therapies, and many other options. And, of course, medical education, early diagnosis, the access of people to treat cancer is also very important. I think actually this is not the right one, but I will pass some of the slides that may not be good for this moment now. So as you see, I decided to ask some of my colleagues for around South America to have their opinions on what would be the best points to discuss here. So Cecilia Yerin from Peru sent me some information. She presented at the IHPBA in Miami in 2020. I think this is the most important point I'd like to show here. So the small number of training programs would be a very important issue on this topic. As you can see here, most of these places, as you can see, for example, 6 in Brazil, 16 in Argentina, 1 in Colombia, 3 in Chile, they are not actually HPB fellowship. They are mostly surgical oncology or general surgery with HPB training included. And there's also a lot of interest on the people who are finishing their residency because they feel insecure on playing important role on HPB diseases. And this may be an important fact that most as 80% of the residents, after they finish their residence, want to do a second specialty or additional training on, for example, HPB diseases. But besides the low fellowship and on HPB training, there are other important topics here you should discuss. We have in South America different diseases too. The epidemiology, the demographics is different. So as you can see, you have some HPB cancers that are very typical from the region, such as HCC in young patients. Very young patients actually viral hepatitis B without cirrhosis, gallbladder cancer associated with gallstones, which is very common, especially in Peru, Chile, ampullary carcinomas. We don't know why, but we have a lot of France tumor with malignant behavior in young women. And on the other side, we have low incidence of pancreatic adenocarcinoma. And there are some places, for example, that they may have less than 5 or 10 whipples per year. But this is the reality. And also have different backgrounds. Here, just some few examples for some of my colleagues and also from Brazil, that most of the training happens during the surgical oncology or general surgery residence. And very few, and also there's something very interesting in Brazil. We have the digestive surgery training too as a residency, and no HPB fellowship or training specifically. Besides, there are some geographic and economic scenarios that may impact on HPB cancer care. But one very important point I could say is the level of HPB cancer care in the main cities, in the capitals, are pretty much similar to what you see in big centers all around the world. The main issue is that there are few centers, not as much as we can see, for example, in Europe or United States. And also, the access for the patients to come to these centers, specialized centers, they are not so easy. And there is a clear disparity of these resources regarding regional and economical scenarios in these different countries. There's also another point that we could discuss about legislation and politics. On the board certifications, for example, we don't have, this is very bureaucratic, and also the HPB recognition as a subspecialty in South America is not a reality, but I don't think this is essential. As you can see here in the US, it's not a board certified as an official specialty, but you have the training and you have the recognition from the public too. And also, it's very important to guarantee the access of a multidisciplinary therapy for all these patients who need assistance. And how to expand, and I would add how to improve the patient care for HPB cancer in South America. First of all, of course, we have to have a strategy on that and understand where to go and what are the main questions. So I think in the session like this, I could see very good examples on where to start with, and this will help a lot. And also implement that as best as we can. Another point that's very important, and we could reach this out among the South American countries, are the collaboration. Collaboration is very important. And some of the main topics we heard from some colleagues is that we may have to create a Latin American HPB board to bring maybe regulation, ideas, some guidance on the HPB surgery. This idea has already been discussed, but not implemented so far. Build multidisciplinary HPB groups around main centers, cancer centers, and around different countries. And there's also something that's already happening, the SOS HPB Latam, that has been created by Mariano Jimenez. And that's something that is meant to help young surgeons in different South American countries, giving some guidance on specific cases they may need help. The other point I'd like to highlight here is the education, of course. I think many associations such as SAGES, HPBA, IHPBA have an important role on that. And this is very important to be sure to include the diversity of people and regions, so we can have the constant innovation on the ideas and a constant learning for both sides of the scenario. Training is also very important. So we should think on stimulating fellowship programs of HPB Latam on Latin America. And so far, there's no HPB training officially, but there's one very important thing happening, which is a try of a multi-country, a free country a fellowship. So the fellow would stay, would be involved and would go through Brazil, Mexico, and Chile, and this is already being discussed and probably implemented very soon. There's a second a program like this being discussed, and we hope this happens in the next 1 or 2 years. Also, we understand that the support from the associations such as SAGES, HPBA, IHPBA are very important. And the development and growth would also depends a lot. We can't just wait the help to come, but there should have a lot of initiative from inside. So each country should go for and look for main ways to help themselves and to get the resources from outside and work together with everyone. Education on patients, I think that's something that's related to better cancer treatment in general, and for HPB, this is a reality too. And we should take advantage also on the e-learning methodology. There are a lot of kinds of e-learning, but with a good methodology, this is a way of doing maybe a continuous education, help people learning from inside. This is very democratic, and at any time and anywhere. Research is another important point here. As we can see, I'll go a little bit quicker here, because research also is a very important way of collaboration, of learning, of innovation, of new ideas, and understanding our own demographics and epidemiology. One very good discussion for the region would be to centralize or decentralize, because of course we know centralization is very important, especially for complex patients as HPB cancer. But on the other side, we have to guarantee the access, so even geographically and economically, people can have access to the centralized treatment, which is expected to deliver better therapy for these patients. So another point I always like to show is the outreach missions. There's another way of collaboration, education, and continuous education too. So I think this is a very important point here, just an example from HPBA. I know SAGE is very strong on that too. And also, after all these points, I'd like to show, actually, we have a team. We have to have a strategy. You have to organize it, and doing probably much better in the next few years. So in conclusion, I think collaboration, expertise through education, training, research, and strategy are the key points for expanding and improving HPB cancer care in South America. And I'd like to give special thanks to those colleagues in South America who gave me some information from the countries, and HPB, IHPBA, and SAGES. Again, thank you.